Hello, everyone, and welcome to Friends of Simon Wiesenthal's Zoom call with Dr. Mark Korman and Dr. Phil Solomon. They are both co-chairs of Doctors4Wiesenthal at the Friends of Simon Wiesenthal Center, and we're very proud to have them. They're on the front lines of combating COVID, along with many other health workers, and we're very proud of their work. We're very thankful for them and for their work every single day, risking their lives. Today, as we've all heard, Ontario health officials have reported 640 new COVID-19 cases and 50 new deaths. Clearly, the daily case growth continues to rise, but recovered patients now outnumber active cases, which is good news. Today's case growth is slightly larger than the 634 recorded cases yesterday, and there were sadly 55 deaths. But the overall trend is a positive one as the province's count of fully recovered COVID-19 patients, 7,087, now eclipse the remaining active 6,432. One of the incredible statistics that I've discovered as well, and I wasn't aware, is that more than 1,700 healthcare workers have contracted the virus in Ontario. So with that, I wanted to hand it off to both Mark and Phil to give us their perspectives. They're on the front lines. Mark, maybe we'll start with you. How do you feel about risking your own life?
Well, I think that all people who are working on the front lines deserve credit, but especially the nurses and the ICU physicians who are dealing with the sickest patients and who are performing the most dangerous types of procedures. But with respect to the numbers that you were highlighting, with the number of cases that are being detected, I think that what we're seeing is that if we haven't seen a true flattening of the curve, we're certainly seeing that the curve is bending down, showing that the isolation and the social distancing that have been implemented are working. In order to keep the peak number of cases down and prevent the overwhelming of the healthcare system, which is the goal of that. The other thing that I think that we're seeing is the result of increased testing. So what we've seen throughout the course of this is that we haven't really known the true denominator, meaning how many cases there actually are out in the community, because testing was not as available. But as we've seen the province ramp up from a few thousand tests a day to 10,000 a few days ago to 14 to 16,000 now, we are seeing increased detection in the community, which may account for part of what you've just described in terms of the number of cases that are presenting on a daily basis.
Dr. Solomon, I wanted to ask you, you're obviously in your clinic, you're working away. Are you seeing patients?
So, Avi, we're basically shut down. I run a private facility called an OHP, which is an out-of-hospital facility for facial plastic surgery. And I'll just give you a little tour. It was just sort of how we are now. We're sort of doing some renovating and cleaning and preparing for when we can reopen and make sure that we're as sterile and safe as possible. We're putting in things like stainless steel countertops, stainless steel washable surfaces. A lot of this was sort of mandated by the ministry in the past, but some of the things we're doing now are we're just sort of trying to make sure that everything's set up as perfectly as possible so that we could clean the place as perfectly as possible to be as clean or cleaner than we were in the past.
I guess what you're saying, Dr. Solomon, I guess what you're saying is really the reality is that when things get going again, healthcare will be very different, and how you do things, how you go about your business will be very different.
Well, we don't know. I mean, most of us think the entire world's going to be very different, and I think healthcare is obviously going to be different as well. I mean, the Ontario healthcare system, we see such high volume of traffic in all fields of medicine, from primary care and even to the surgical side of things. The volumes seen in Canada in a universal healthcare system are very high, and with something like a pandemic, it is going to add more complexity to managing that. So the system will likely be shifted or changed. Maybe we can make changes in the system that are for the better and improve healthcare altogether. This pandemic, while tragic, hopefully we can try to create some positive things in the healthcare system by improving access and reduce redundancies and waste in the system as well, while providing good quality care.
That makes sense. Dr. Korman, you've been on the front lines, you've been testing. Can you tell us about that? How has that been?
So yeah, our institution, William Osler, has two COVID assessment centers, one in Etobicoke, which is a drive-through center, and one at our Peel Memorial campus, which is run through the Urgent Care Center. And that has been going very well, and we're seeing really increased traffic through there from, at the beginning, seeing 40 to 50 individuals coming through per shift, to now seeing upwards of 200 coming through per shift. And it's very efficient, and the wait times are generally pretty low, so it's really improving access to testing. And it's allowing us to implement the new provincial recommendations for testing, particularly among healthcare workers and those who are on the front line, such as either living in or working in group living facilities, long-term care, and so on. So yeah, the assessment centers are doing well.
Now, you both have families, you have young families, you're out there, you're being exposed, you're talking to patients. How is it feeling at home?
Well, certainly, when we are at the assessment center, the doctors and the nurses that are there are wearing appropriate personal protective equipment, including gowns, masks, face shields, gloves, and so on. You change your clothing in and out. We're performing frequent hand hygiene. And, then, when I get home, we generally sort of, take off all of the clothing that we were wearing out of the home, straight into the laundry and straight into the shower, to try to minimize the risk to families. I think that the risk is probably more heightened among those who are doing airborne generating procedures, intensive care physicians, respiratory therapists, and so on, who are taking even more enhanced precautions.
Right. It's unbelievable, the risks that you're taking. And I wanted to get your general thoughts about this final statistic, which I read, and I just couldn't believe it. It's really sad and devastating what is happening to the elderly and in senior care. 763 people have already died in our province. But of the 763, only 39 people were under the age of 60, according to statistics. It's really unbelievable how this has impacted those above 60. And I wanted to get, your reflections on that.
Well, there's definitely a polarization of outcomes that we're seeing. So with COVID, as we know, children can have very minimal or no symptoms at all. There are no fatalities that I'm aware of in Canada under the age of 10. The risk of hospitalization goes up dramatically over the age of 50 and exponentially over the age of 75. So, that is why we are seeing this increased morbidity, i.e. sickness, and mortality, i.e. deaths, particularly among those who are residents of long-term care facilities and nursing homes, which have really become the epicenter. Something like half of the mortality that we've seen in Canada are those who reside in long-term care facilities. So they are a particularly at-risk population. And what we're also seeing is spread, including asymptomatic spread, by the support workers, the PSWs, and the staff at these facilities, who have also been affected by at wildly disproportionate rates.
Yeah. I think, Avi, the issue is that we still have so many unknowns about this particular bug. We understand that people with comorbidities or the elderly are certainly at more risk. And obviously, we're trying to protect that part of our population. Younger people with other medical issues are at risk. There may be some young people who are healthy that we see on the news that have succumbed to this and ended up on ventilators in New York City, and I believe even some in Toronto. But we don't really understand exactly why some young, healthy people seem to get so sick from this bug. And we wonder if there's more than one version of it, a mutation of this bug, or other variables that we're really not aware of at this time. And that's what makes it so scary. Also, I'd like to say, the healthcare system currently is pretty much shut down other than for extreme emergencies and for treatment of COVID. Cancer care has been delayed. Other elective procedures that are essential for, a healthy healthcare system, call it that, are shut down and delayed. The entire dental community is shut down. And, while obviously it's critical that we shut down, we also have to start thinking about how we're going to reopen in a safe, methodical way. And I think that's going to be the challenge for the government and the healthcare system. At some point, hopefully soon, we're going to get people back to work and allow people to get back to seeing their primary care physicians, their dentists, and other healthcare providers.
I got to tell you, the havoc that this has caused on society is unreal and unbelievable. And you guys are on the front line. Your field is on the front line, and we're all very proud of you. And I wanted to just ask you one last question before we depart is, social distancing. I'm seeing on the street a little bit more activity. I don't know if you guys are. What are your thoughts on that? Should this be maintained? Are we now getting to a point where we might be able to start opening up just a little bit?
I think we're going to have to make some tough decisions, and we're going to have to, at some point, once the numbers seem like they have been curbed, make decisions to start implementing, some types of, resumption of normal activity with social distancing in a safe manner. I'll just show you, the types of things we're doing. We're doing some renovating on the main floor of our office. And I'm just showing this because I think many healthcare facilities in Ontario are probably doing the same thing. We've put up these barriers, and so it's going to protect our staff when they get back. We're going to be reducing the number of patients that are seen in our waiting rooms. The number of patients that could be seen in a given examination room will be reduced. Yeah. And then we're going to have to implement sterilization techniques to even wash down the rooms as each person comes and leaves the facility. So that's obviously going to decrease the volumes and access for people to their doctors. And I've been speaking to family physicians and dentists, and they're all sort of doing the same type of thing.
Makes perfect sense, and it's really the new reality of the situation. We're all taking precautions, even in our own office. So thank you again to the both of you for your insight and for your input, and really for your guidance. We need it very much these days more than ever. We appreciate, for everyone who's in the healthcare field, we appreciate everybody's help and support. And we're here. So thank you so much, and wishing you a good day.
Thanks, Avi.
Thanks, Avi.